Hi, welcome back. Today we're going to be talking about a fun topic. You may have noticed if you visit a dermatologist that the majority of them have really, really nice skin. And today I'm going to be giving you 5 hacks that you can follow so you can have nice skin also, just like most dermatologists. So these are secrets that dermatologists sometimes will tell you, sometimes won't tell you. So let's dive right in. Number one is going to be retinol. So most dermatologists use some form of retinol. So this would be retinol, tretinoin, adapalene, Tazorac. There are a lot of different forms of this molecule. So that would be my number one thing is if you don't have a retinol in your routine, I highly recommend working with a dermatologist and finding one that works well with your skin and your skincare routine. Number two would be most dermatologists understand the power of lasers. Lasers are such a great investment in your skin quality, both over the short term and over the long term. Investing in one high quality laser session a year will do such amazing thing for your skin over time. It can help keep your lower face tight. It can help keep your neck tight. And it can avoid some of those cosmetic surgeries later in life if you keep up with your laser routine. So that would be number two, would be invest in high quality laser procedures. Not even that frequently, even once a year will make such a big difference in how your face ages over 20 or 30 years. Number three would be a minimalist skincare routine. Most of my friends and colleagues that are dermatologists do not do a 5 or 10 step skincare routine at the end of every day. Myself, I put on a retinol a couple times a week, and that's pretty much it. I will put on some SPF in the morning. And if I'm going somewhere dry, like going skiing or, we're having a dry spell here in Florida, I'll put on some really gentle moisturizer, but that's about it. You do not need a 10-step skincare routine. The high quality skincare products have such good, amazing technology now that we've gone from needing all of these different products to get that amazing result to, I tell my patients one thing in the morning, one thing at night will do really, really well for your skin for most patients. So keeping that skincare routine as minimal as possible can definitely help your skin age over time. Number 4 hack to get the skin of your dermatologist is to ask your dermatologist about whether a compounded prescription is the right option for you. So we talked about adding a retinol into your routine, and a really great way to get a retinol in there is to add it to what's called a compounded prescription. So let's talk about what that is. As a physician, if I'm writing a prescription for a patient, that means it's a certain level of drug that has to go to a pharmacy. The drug company makes it, the pharmacist dispenses it to the patient. It's not over the counter. So a compounded prescription is when instead of sending just one drug to the pharmacy, what I'm telling the pharmacist to do is to compound several active ingredients together and make a customized formula for that patient. And the reason why that's really amazing is because I get to kind of play chemist and decide, these are the, however many active ingredients your compounding pharmacy has, 20 or 30. I get to choose a couple of those, customize it to the patient's skin and their, concerns and where they are in the aging process, and really deliver a topical that can address all of their concerns in just one step. Some good examples of this would be if you have melasma, we can target a lot of the browns, the anti-aging, a lot of those things with just one compounded. If you have acne rosacea, compounded prescriptions are really, really great and they can help you. So that would be my next hack would be talk to your physician, talk to your dermatologist about whether a compounded prescription is going to be a good fit for your skin. So let's talk about my next hack, number 5. And this would be consistency. A lot of dermatologists just stick to the same skincare routine for years, decades. They keep it simple, like we talked about, and they use those tried and true ingredients like retinol and SPF every single day or on a weekly basis, whatever the case is. So staying consistent with your regimen can really, really help for 2 reasons. One, you're going to get compound benefits using retinols, especially over kind of years, decades. And the second one is you're going to avoid any potential irritation from trying new products. So just stay consistent with a routine. Find a routine that works for you, that can help you achieve your skin goals. Definitely talk to a dermatologist and get their advice and stick with it for months, years. It doesn't mean that we don't ever change. I change for two reasons. One is if my skin changes. Sometimes with hormonal changes, women's acne can flare, and I'll kind of work in and out an acne product or whatever it is. If I spend a lot of time outside, sometimes I'll switch to a compounded prescription to deal with some of the brown spots here in Florida. So I'll change my routine based on how my skin is doing. When new products do come out, I like to test them all for my patients. So I will change my routine if really, really convincing technology comes out. I would say the biggest change in technology for skincare over the last couple years has been the advancements of the retinoids, making them much more tolerable for patients. Even 5 to 7 years ago when I started this practice, I was still using the prescription tretinoin because that was what was best on the market. And I've actually switched to some of the physician grade retinols because they have clinical data showing that it's just as effective as tretinoin 0.05, which would be a mid-strength tretinoin, but they're much more tolerable. So you get much less peeling and much less redness, much less skin sensitivity. So those are the two reasons that, you can think about changing your skincare routine is if your skin changes or if there's really, really convincing technology on the market. But other than that, stay consistent over years, decades, you will see a significant change in your skin. So we went over 5 hacks that help dermatologists like me keep really nice skin. I'm going to give you a bonus one and I'm making it a bonus because you already know this. But the other hack is most dermatologists I know put on SPF every morning. So if you're not doing that, definitely consider it. I think, living in Florida, even that 2 to 3 minutes that we get every day unprotected can really add up over time. So if you have 10 to 15 seconds, put that SPF right next to your toothpaste in the morning, swipe it on. It'll help with skin cancer. It'll help with aging. So that would be my bonus hack for you. Thank you so much for listening. If you have any questions, feel free to reach out. Thanks.